Hello everyone, myself Lokeshwari from 1st MSc Microbiology, Sacred Heart College, Tirupattur. Let us discuss about the topic antibiotic sensitivity test. The aim of the antibiotic sensitivity test is to check the ability of the antibiotics to inhibit the growth of the microorganism. It also determines the sensitivity of the antibiotics against bacterial pathogen. The antibiotic sensitivity test is used to check the effectiveness of a bacterium and also selects the best drug which is acting against bacterium. Antibiotics are the medicine which is used to fight against bacterial infections. There are different types of antibiotics. Each type is only effective against certain bacteria. Antibiotic sensitivity test can help us find out which antibiotic will be most effective in treating an infection. This test can also be helpful in finding a treatment for the antibiotic resistant infection. It happens when a standard antibiotic becomes less effective or ineffective against certain bacteria. Antibiotic resistance can turn once easily treatable diseases into serious, even life-threatening illness. Other names of antibiotic sensitivity test are antibiotic susceptibility test, sensitivity testing, antimicrobial susceptibility test. It is an in vitro test which determines the sensitivity or the resistance of a bacteria to a particular antibiotics. Some of the methods used to test antibiotic sensitivity are diffusion method, which is otherwise known as Kirby-Boyer method, dilution method, which is the minimum inhibitory concentration, diffusion and dilution method, epsilometer test. Kirby-Boyer method. It is otherwise known as a disk diffusion test. It was developed in the year 1950s by W. Kirby and A. Boyer. It was standardized by the World Health Organization in the year 1961. It is used to determine the resistance or the sensitivity of the aerobes or the facultative anaerobes to the certain chemicals. It is used for treating the patient with the bacterial infection. The presence or the absence of an inhibitory area around the discs identify the bacterial sensitivity to the drug. The principle of the Kirby-Boyer test is the antibiotics are placed in a paper disc and then placed in a Muller-Inter-agar plate by using sterile forceps. Then the plates were incubated for 16 to 18 hours. The diameter of zone of inhibition is also measured. Inhibition zone H shows the susceptibility or the resistance of a particular bacterium. Diameter of a zone of inhibition is also measured using a ruler. Kirby-Boyer testing. Bacteria are placed on a plate of a solid growth medium and wafers of the antibiotics which are added to the plate. After allowing the bacteria to grow overnight, areas of the clear media surrounding the discs indicate that the antibiotic inhibits the bacterial growth. Zone of inhibition is measured by an area of a media where the bacteria are unable to grow due to the presence of a drug, which indicates the growth. Minimum inhibitory concentration. This is the lowest concentration of antimicrobial drug which prevents the visible growth of an organism after overnight incubation with the media. Materials required to do antibiotic sensitivity test are 24 hours culture of bacteria, Muller-Inter-agar, antibiotic disc, petri dish, sterile cotton swab, glasswares, Bunsen burner, sterile forceps, metric ruler or caliper. The methodology of doing antibiotic sensitivity test are: first sterilize the area with the disinfectant and open the burner before performing the test. A sterile cotton swab is dipped into an inoculum. Next, swab the surface area of the plate completely by rotating the plate. Allow the plates to dry for 5 minutes so that the medium absorbs the inoculum properly. Sterilize the forceps with the alcohol before picking up an antibiotic disc. Disc should be placed at a distance of 24 mm. Lastly, incubate the plate upside down for 24 hours at 37 degrees Celsius. The results of the antibiotic sensitivity test are visible immediately after incubation, with large zone of incubation appearing around the disc indicates that the antibiotic is effective against a present bacterial or the fungal strain. If no zone of inhibition is present, then there is an indication for resistance against the bacterium. The uses of the Kirby-Boyer method are: it is a very important test which is used to monitor the antimicrobial resistance. It is the best antimicrobial agent against bacteria. It also acquires information on the microorganism of the public health importance. It is the test which is used to find the best treatment for a bacterial infection. It may also be used to find out which treatment will work best on certain fungal infection. It is a simple method and widely used method for disk diffusion test that determines the susceptibility of an organism based upon the zone of inhibition of the organism, which is seeded in an agar plate by using radiation diffusion of an antimicrobial from a paper disc immigrated with a drug. The advantages of the Kirby-Boyer method are: it is used in determining the antibiotics to treat an infection. It is also useful in monitoring the antimicrobials, selection of the proper antibacterial agents. It does not require any special equipment to perform. It also costs less to perform antibiotic susceptibility test. It also helps to identify the bacteria which have a constant pattern. Limitations of the Kirby-Boyer method are: slow or fastidious organism can be tested accurately. It is used only for the screening of susceptibility pattern of an organism according to the CLSI guidelines. Minimum inhibitory concentration cannot be determined. Fastidious organisms can be tested accurately. It cannot distinguish between the bacteriostatic and bactericidal activities, and differences in the zone sizes cannot be used to compare drug potencies or efficacies. The main disadvantage of the disk test is the lack of mechanization or the automation of the test. It does not allow all the fastidious or slow-going bacteria which can be accurately tested. Thank you.